I am a urologist and pelvic surgeon, and today we're going to talk about some new breakthroughs in prostate cancer detection in 2025. It is a very exciting year. Stay tuned. So the way that we currently screen for prostate cancer is with a prostate-specific antigen test or a PSA, and then if that is abnormal, doing a prostate biopsy. However, we know that that can be a very inaccurate test, and there's a lot of men who get biopsies who do UNT need them, and a lot of cancers that are missed on biopsy. So we're always trying to improve the way that we screen for prostate cancer, and there have been 4 areas that have had major breakthroughs in 2025. The first is the use of artificial intelligence or AI to help detect prostate cancer earlier. So there was a study that was just published looking at over 16,000 men's, and what they did was they trained an algorithm or an AI to look at those MRI scans and determine whether or not they were suspicious for cancer or not. And what they found was that this AI was able to detect cancers that were missed by radiologists 44% of the time. So this is really incredible technology. And what they're hoping to do is to take these scans, which we already have the technology to get very high quality images through a prostate MRI, send it to a company like a Google or an IBM who will train their, and hopefully in the next few years have this as a tool that we can incorporate into our workflow to help us detect prostate cancer earlier. The second area is the use of liquid biopsies. So a liquid biopsy is essentially taking a blood sample and looking for tumor DNA or RNA fragments in the blood. And there are several companies working on this, but one of the ones that has shown the most promise is a company called ONS. And what they did was they looked at a small trial of 100 men, 50 with prostate cancer and 50 without. And they found that they were able to correctly identify 84% of the men with prostate cancer and 89% of the men without prostate cancer. Now obviously, this is a very small trial, so we need more data. But ultimately, if this holds up, this could be a great screening tool, especially for men who are at very low risk for having prostate cancer, because you would want to put somebody at undue risk of getting a cancer if they do really need to get screened. The third area is looking at other biomarkers or substances in the blood that may help predict whether or not a man has prostate cancer. The fourth area is looking at the use of digital rectal examination or DRE findings and incorporating that with either a PSA or a prostate MRI. So while we know that the digital rectal examination or DRE is not a great tool to screen for prostate cancer, it is really good at identifying whether or not a lesion that may be found on MRI or may be found on biopsy is actually clinically significant. And so there's been a couple studies that have shown that incorporating your DRE findings with either the PSA or with the prostate MRI can improve risk stratification and identify men who truly need a biopsy and those who do not. So overall, I think the future of prostate cancer screening is moving towards a risk stratification algorithm. So basically taking a man's age, their race, their family history, maybe their digital rectal examination findings, and maybe even incorporating a prostate MRI into that. And then based off of that, if you're above a certain threshold, then proceeding with a biopsy. As always, I hope you guys enjoyed this. And if you have any questions, please comment below and I'll be happy to answer them. As always, remember to take care of yourself because you're worth it.